So you have understood this. Now let us tell you the examples of proportionate short stages. So examples of proportionate short stages. Proportionate short stages. So now the examples are: first, endocrinal disorders. Endocrinal disorders, which includes growth hormone deficiency. Or example, Cushing syndrome. So whenever an endocrinal disorder will present with short stature, it will present with a proportionate short stature. Second good example of a proportionate short stature, chromosomal disorders. Chromosomal disorders. Example of chromosomal disorders which can present with Turner syndrome or even Down syndrome. Third example of proportionate short stature, malnutrition. Third example, malnutrition. Fourth example, systemic diseases. One of the examples, chronic renal failure. All of them will present with proportionate short stages. Proportionate short stages means the upper segment to the lower segment ratio will match for that age. You understand? So examples, endocrinal disorders such as growth hormone deficiency, such as Cushing syndrome, then chromosomal disorders such as Turner syndrome, such as Down syndrome, malnutrition, systemic diseases. These are examples of proportionate short stages. So if you see this now, I think now you can understand this slide better. This is how I divided short stages. So first is normal variant short stages. Normal variant short stages, as I told you, are also known as physiological short stages. So which are the two normal variant short stages? One is familial short stature and the other is the constitutional delay. In both cases, the growth velocity is normal. So that is why we called it as physiological short stages or normal variant short stages. Normal variant short stages in which puberties always are on time, familial short stature, and normal variant short stages in which puberties are delayed is a constitutional delay. Then pathological short stages. Pathological short stages, as I was telling you, are type of short stages in which the upper segment to the lower segment ratio can either be normal or it not is non-normal. So pathological short stages are divided up into two categories. Either they can be called as disproportionate or they can be called as proportionate. So disproportionate, I told you, are of two types. One is infantile disproportion. When I said infantile disproportion is when the upper segment to the lower segment ratio is more than expected. And if the upper segment to lower segment ratio is less than expected, then we call it as advanced disproportion. Upper segment to the lower segment ratio less than expected. What is an example of infantile disproportion? I told you a type of a bone disorder which is known as achondroplasia and congenital hypothyroidism. And what was the example of example of advanced disproportion? It is spondyloepiphyseal dysplasia, another type of bone disorder. Then the proportionate short stitches, I told you, can be chromosomal disorders, endocrinal disorders, systemic diseases, and the fourth one I told you is malnutrition. So I hope this is now pretty simple and you have understood this short stitches very well, because this is an important topic, slightly confusing topic, and students, I find, at least for PG entrance exams, whenever they ask me questions, they appear to be a little confused here. What I'll do is I just will revise this after some time. But first, as I was telling you, I wanted you to know about the body proportion ratio. How does the upper segment to the lower segment ratio change with age? So this is for knowing proportionate and disproportionate short stitches. Remember, so upper segment to lower segment ratio is 1.7 at birth. That means the upper segment is more than the lower segment at birth. And what is the ratio? 1.7. But after birth, what happens is the lower segment starts growing very fast. So the ratio goes on decreasing. So the ratio becomes 1.5 at 2 years, becomes 1.3 at 3 years, becomes 1.1 at 6 years, and upper segment becomes equal to the lower segment between 7 to 10 years. This is again an FMG question. When does the head circumference becomes equal to chest circumference? Remember, the head circumference becomes equal to the chest circumference, if you remember, I told you, between 9 to 12 months of age, while the upper segment becomes equal to the lower segment at between 7 to 10 years of age. Both of them are important for your exams and you should remember. So how does the body proportion ratio changes with age? So it is 1.7 at birth, it is 1.5 at 2 years, it is 1.3 at 3 years, it is 1.1 at 6 years, and it is 1 somewhere between 7 to 10 years. So when does the upper segment becomes equal to the lower segment? It becomes equal to the lower segment between 7 to 10 years. Okay. This is how the disproportion looks. You can see the disproportion in the body. You can see the disproportion. You can see the upper segment is much bigger in comparison to the lower segment. You see? So the upper segment here is more than the lower segment. So which type of disproportion will this be? This will be infantile disproportion. Infantile disproportion. Infantile disproportion is when the upper segment to the lower segment ratio is more than expected. So this is infantile disproportion. Upper segment to lower segment ratio more than expected means the upper segment is bigger than the lower segment. And what were the examples I told you? Congenital hypothyroidism, achondroplasia. And this is the type of disproportion which is known as advanced disproportion. Now just see the upper segment. This is the upper segment. And in comparison, the lower segment is bigger. So now here, what is happening is, this is the case in which the upper segment is less than the lower segment. That means the upper segment to the lower segment is less than expected. This is known as advanced disproportion. So infantile disproportion, the two examples I told you were achondroplasia and congenital hypothyroidism. Advanced disproportion, I told you, was spondyloepiphyseal dysplasia. So just let us quickly revise, and then we'll finish up short stature. So let us quickly revise. Short stature, then this is just all revision. Short stature divided up into two. One is known as physiological short stature and one is known as pathological short stature. I don't think now there is anything to write. Just understand and just keep on revising. Physiological short stature is also known as normal variant short stature. because the growth velocity is normal. Pathological short stature, the growth velocity is decreased. Physiological short statures, then I told you, are again divided up into two categories. One is familial short statures and one is a constitutional delay. What is the difference? First, familial short stature, the final height is always short, while in the case of a constitutional delay, the final height is usually normal. So which type of physiological short stature the final height is reduced? It is familial short stature. Which type of physiological short stature the final height is normal? It is a constitutional delay. Second, puberty. Puberty is always on time in a familial short statures, while puberties are usually delayed in a case of a constitutional delay. So which type of physiological short stature? The puberties are on time, it is a familial short stature. And which type of physiological short statures the puberties are delayed? It is a constitutional delay. Then pathological short stature, how did we divide it? So now I will just remove this physiological short stature so that you can so let us now let us focus on pathological short stature. Pathological short statures, I told you, are divided again into two categories. One is proportionate, when the upper segment to lower segment ratio matches with that age. The other is disproportionate, when the upper segment to the lower segment ratio does not match that age. Now, disproportionate short statures again are of two types. When the upper segment to the lower segment ratio is more than expected, we call it as infantile disproportion. And when the upper segment to the lower segment ratio is less than expected, we call it as advanced disproportion. Example of infantile disproportion I told you was achondroplasia, which is a type of a bone disorder, and the other was cretinism or congenital hypothyroidism, especially a congenital hypothyroidism which has not been treated, untreated congenital hypothyroidism. While which is the example of advanced disproportion, I'll write it here. Example of advanced disproportion is spondyloepiphyseal dysplasia. This is again a type of a skeletal disorder. And finally, what were the types of proportionate short stitches? I'll write in a different color so that you can understand it easily. So one was endocrinal disorders such as growth hormone deficiency. Second is chromosomal disorders such as Turner syndrome or Down syndrome. So which type of chromosomal disorders present with short stature? Turner syndrome, Down syndrome. Then another example of a proportionate short stature, systemic diseases such as chronic renal failure. And the last type is malnutrition. So these four are the type of proportionate short stages, and all pathological, all have underlying pathologies. It may be endocrinal disorders, it may be chromosomal disorders, it may be systemic disorders. The point is disorders. So there always are pathological. Physiological short stitches, there is no underlying disorder. It is imprinted in the genes. But in pathological short stitches, there are underlying causes, underlying disorders. Be it proportionate, be it disproportionate, there are underlying disorders. That is why we say these are pathological short stitches. Finally, the last thing. Which is overall most common type of short stature in children. I have talked about so many short stitches. Overall, most common short stature in children is a constitutional delay. This is again an FMG question. Which is overall the most common type of short stature in children? It is constitutional delay. But is it physiological or pathological? It is physiological. So the second type of question that is asked is, which is the most common pathological short stature in children? Then it is malnutrition. So there should be no confusion. Just read the question carefully. Which is overall the most common type of short stature in children? When I say overall the most common type of short stature, it may be physiological also, it may be pathological also. Taking all of them together, the most common type of short stature in children is a constitutional delay. But constitutional delay is not a pathological short stature. So which is the most common pathological short stitches? Remember, pathological short stitches: disproportionate, proportionate. Disproportionate, infantile disproportion, advanced disproportion. And proportionate, chromosomal disorders, endocrinal disorders, malnutrition, systemic diseases. Among all pathological short stitches, which is the most common? It is malnutrition. So both of them are very, very important questions for your exam. Most common type of short stature, constitutional delay. Most common type of pathological short stature is malnutrition. Now we come to milestones. Now when I'm teaching milestones, what I would just expect you to is to just keep on writing the milestones. Milestones is not something that I can teach. Milestones is something that you have to write and remember for your exams. If you remember, when I started my class, I told growth and development are not the same. Growth is increase in the size of an individual, but development is acquiring milestones. So milestones is one of the best ways to know whether the brain of the child is normal or not. If the child's brain is functioning normally, usually the milestones keep on appearing on the normal time. So as a pediatrician, I should know what is the normal time of appearance of different milestones. Milestones usually, for your examination purposes, milestones will be divided up into 4 categories: gross motor milestones, fine motor milestones, language milestones, and social milestones. And you have to remember these milestones. Please remember, I tell this to my students whenever I'm teaching in the PG entrance exams also. For the PG entrance exams also, students, in the FMG teaching also, I convey the same message. My message is, everything else I can teach. Milestones is something I cannot teach. I just can tell you the milestones. You have to remember them for your exams. And the time, go through the milestones, and that will help you keeping the milestones there in your head. The age of different milestones, and we milestones, we divide them into gross motor, fine motor, language, and social milestones. So I will keep on showing you the different type of milestones. Please keep on writing them. And we start with the gross motor milestones first. So what are the gross motor? Remember, I told you we'll do milestones in 4 categories: gross motor milestones, fine motor milestones, language milestones, and the social milestones. So let us start with gross motor milestones. Say head control. If you see any child who is born, the child is not able to keep his head supported on the head. So his head drops like this. This is because there is no tone in the head. So when I keep a child, please pay attention here. When I keep a child upside down, prone on the bed, what is the first time the child will be able to lift his head spontaneously above the surface of it, spontaneously, without any help? That means when does the child achieve first sign of head control? It is 6 weeks. So first sign of head control in a child is achieved at 6 weeks. That is the time when in the prone position, the child is first able to lift his head above the surface of it. Now the tone starts improving. And when the tone starts improving, next is when is the partial head control achieved. Now he is able to support his head above the surface of it. He is able to. But what happens is head is not static. So head keeps on wobbling like this. This is known as a so some amount of wobbling of the head like this. A partial head control is also known as a neck control. So if they say a neck control in a child is achieved at the age of, answer will be 3 months. It is the same as a partial head control. And a complete head control, that is when the child's head stops wobbling. So its head is like yours and mine. It is static like this. There is no wobbling present like this. A complete head control or a neck control is achieved at the age of 5 months. So what is the first sign of, when is the first sign of head control achieved? It is 6 weeks. When is the partial head control, also known as a neck control, achieved? It is 3 months. And when is a complete head control or a complete neck control achieved? It is at the age of 5 months. Again and again I am saying, now this is something that I do not need to teach you. You have to remember them for your exams. So they ask you in the exam, when is the neck control achieved? Neck control is the other name for partial head control. It is 3 months. When is a complete neck control or a complete head control achieved? Answer will change to 5 months. Next, when does the child start sitting with support? So we are doing the gross motor milestones only. We are still in the gross motor milestones category. When does the child sits with support? It is 5 months. But when does he sit in a tripod position? This is a tripod position. You can see the tripod position. The child has his hands move forward and is sitting in a tripod position. So although tripod position is also like sitting with a support, but the answer will be slightly different for your exams. So when does a child sits with support? 5 months. But when does a child sits in a tripod position? It is 6 months. When does a child start sitting without support? So now there is no support. When does a child start sitting without support? It is at the age of 8 months. So please, no confusion. Sits with support at 5 months, sits without support at the age of 8 months. In between, sits in a tripod position at the age of 6 months. When does a child crawls? When does a child creeps? Now please understand. Just see this picture. In both cases, the child is on his hands and knees. In both cases, hands and knees. But when the abdomen is touching the surface, here you can see the abdomen is touching the surface. This is known as crawling. But when the abdomen is raised above the surface, it is known as creeping. It's very important to know about these milestones also, how they look like, because sometimes they are asking, now we have in PG entrance exams, we have different types of pictures that are being given and they say this milestone is achieved at the age of. So if they show you this first picture, you should know this is a child who is not creeping, he is a child who is crawling. So a child crawls at the age of 8 months, but the child creeps, which is picture number 2, at the age of 10 months. But at 10 months, the child is creeping on level ground. When does the child creeps on stairs? The child creeps on stairs at the age of 15 months. So they ask you, when does the child start creeping? The child starts creeping at the age of 10 months. But when does the child start creeping on stairs? The child starts creeping on stairs at the age of 15 months. When does a child stands with support? So the child stands with support at the age of 9 months. So he holds on to a support and can stand for some time. So when does a child stands with support? It is at 9 months. When can he leave the support and can stand for a few seconds? He can stand without support at the age of 12 months. This again is an FMG question. So when does a child stands with support? He stands with support at the age of 9 months. But when can he stand without support? He can stand without support at the age of 12 months. So when does he starts walking with support? So he holds on to a support, say for example a table or furniture, and he starts to walk. So children can walk between 10 to 11 months, as you can see on your screen. But at 10 to 11 months, when they are walking with support. When can they walk without support? Children can walk without support at the age of 13 to 15 months. So this is walking without support, 13 to 15 months. Walking with support, 10 to 11 months. In between, there is one milestone. When does the child walks with one hand held? So it is somewhere between walking with support, walking without support. So father has held one hand of the child and the child is now walking. So the child can walk with one hand held at the age of 12 months. So when can he walk with support? It is 10 to 11 months. When can he walk with one hand held? It is 12 months. And when can he walk without support? So now he's not holding on to any support and he's walking. This is at the age of 13 to 15 months. So sits with support 5 months, sits with support in a tripod position 6 months, and sits without support 8 months. Crawls at 8 months, creeps at 10 months, and you can see the pictures crawling and creeping, but creeping on stairs only at 15 months. Stands with support 9 months, stands without support at the age of 12 months. Walks with support 10 to 11 months, walks one hand held at 12 months, and walks without support at the age of 13 to 15 months. All of these are still gross motor milestones, and the next slide I will show you is again some more gross motor milestones. When does the child start climbing stairs? The child starts climbing stairs at the age of 2 years. But how is he climbing? His climbing is different from how we are climbing. So first he puts one foot on a step, then he puts the other foot on the same step. So first he puts one foot, then other foot. So he goes slowly one step at a time upstairs, slowly comes one step at a time downstairs. So he's moving on stairs very, very slowly, putting both the foot on each step, both while going upstairs, while coming downstairs. We do not move like this. So how does the child move like we do? Alternate foot per step. So going up, coming down, alternate foot per step, he can move at the age of 4 years. Finally, two more milestones. When does the child hops? When does the child skips? So hopping is on both foot. So the child hops at the age of 4 years and he skips at the age of 5 years. So let us revise these milestones once again. When does the child achieves the first sign of head control? 6 weeks. Partial head control or neck control 3 months. And a complete head control or complete head control at 5 months. So sits with support. So sits with support at 5 months, sits with support in a tripod position 6 months, sits without support 8 months, crawls at 8 months, creeps at 10 months, but creeps on stairs at the age of 15 months. Then when does the child stands with support? 9 months, stands without support at the age of 12 months. Then he walks with support at 10 to 11 months, walks one hand held at 12 months, and walks without support at the age of 13 to 15 months. Then he climbs stairs at 2 years, but that is putting both the foot on each step. So slowly going upstairs, slowly coming downstairs. But he goes normally upstairs and downstairs, alternate foot per step, only at the age of 4 years. That is how we walk. Then the child hops at the age of 4 years and he skips at the age of 5 years. So this is all gross motor milestones. So the first category completed, gross motor milestones. Let us now start with the second category, which is fine motor. Fine motor means the use of hands, the grasp. The first thing that you need to remember in fine motor milestones is how does a child catch objects when they are kept in front of him. So initially he uses both the hands to catch the object, then he uses one hand to catch the object. When he uses both the hands to catch the object, it is known as a bidextrous approach. When he uses one hand to catch the object, it is known as a unidextrous approach. So initially the child uses both hands to catch the object. This bidextrous approach is achieved at the age of 4 months. Later on, he starts using one hand to catch the objects. That is known as a unidextrous approach, which is achieved at the age of 6 months. So bidextrous approach, 4 months. A unidextrous approach, 6 months. Now when he is catching objects, how is he catching objects? Just pay attention here. How is he catching objects? Initially he catches objects using the ulnar aspect of the palm. This type of a grasp. So you are seeing he's not catching objects like this. He's catching objects using the ulnar aspect of the palm. This type of a grasp is known as the ulnar grasp. So the first type of grasp is the ulnar grasp, which is achieved at the age of 6 to 7 months. So he's not catching objects like this in his hand. He's catching objects like this in his hand. This is known as the ulnar grasp. So ulnar grasp achieved at the age of 6 to 7 months. Later on, he starts catching objects using the base of the thumb. Just see this. Using the base of the thumb, he's catching objects. He's still not catching objects like this. Base of the thumb. So he's catching objects like this. This is known as the radial grasp, which is achieved at the age of 8 to 9 months. Finally comes the pincer grasp. This is the pincer grasp between the thumb and the index finger. Pincer grasp. This is achieved at the age of 9 months, but this is immature pincer grasp. So when does a child achieves a mature pincer grasp? It is at the age of 12 months. So bidextrous approach using both the hands, 4 months. Unidextrous approach using one hand, 6 months. Ulnar grasp, 6 to 7 months. Radial grasp, 8 to 9 months. This is pincer grasp. Pincer grasp at 9 months and a mature pincer grasp at 12 months. Some more transfers objects. So when does the child transfers objects from one hand to another hand? Shift of objects from one hand to another hand. So when does the child transfers objects from one hand to another hand? At the age of 5 to 7 months. So between 5 to 7 months, he can transfer objects. When does he play a ball game? So what is a ball game? He gives a ball to the child. You give a ball to the child will catch the ball. When you release that ball, the child will catch the ball, and when you ask for that ball, the child will release the ball. So the child is doing both the things. He's catching the ball when the ball is coming to him, and when you are asking for that ball, he's releasing the ball. So when does a child plays a simple ball game? So that means he can catch objects voluntarily, and he can release objects voluntarily. So when he can catch the objects voluntarily and release the objects voluntarily, this is playing a simple ball game. That can be done at the age of 12 months. Then after this, some more fine motor milestones. Tower of cubes. So a child can, so he's again using the grasp. So this is a type of fine motor milestones only. So when does he make a tower of 2 cubes? 15 months. So he takes one cube, puts another cube of the first cube. So he makes a tower of 2 cubes at the age of 15 months, a tower of 6 cubes, 1 cube, 2 cube, 3 cube, 4 cube, 5 cube, and 6 cube. A tower of 6 cubes at the age of 2 years, and a tower of 10 cubes at the age of 3 years. So he can make a tower of 2 cubes at 15 months, a tower of 6 cubes at 2 years, a tower of 10 cubes at the age of 3 years. So he's making tower of cubes. Then when does he starts to scribble? So if you give a pen to him, he's not able to make a line, but he's scribbling like this. So when does a child starts to scribble? A child starts to scribble at the age of 15 months. Then he copies a line at the age of 2 years. Then he copies a circle at the age of 3 years. So a line at the age of 2 years. Circle at the age of 3 years. So he's making a line at the age of 2 years. Then he's making a circle at the age of 3 years. Then a cross or a plus he's making at the age of 4 years. So a line at 2 years, a circle at 3 years, he can copy a cross or he can copy a plus at the age of 4 years. Then he can copy a square or a rectangle again at the age of 4 years. So when can he copy a square or a rectangle? He can copy a square or rectangle again at the age of 4 years. Then he can copy a triangle at the age of 5 years. And he can copy a hexagon at the age of 6 years. So I'll again repeat. He scribbles at the age of 15 months. He can copy a line at the age of 2 years. He can copy a circle at the age of 3 years. He can copy a cross or a plus at the age of 4 years. He can copy a square or rectangle at the age of 4 years. He can copy a triangle at the age of 5 years. And he can copy a hexagon at the age of 6 years. Before this, I told you he can make a tower of 2 cubes at the age of 15 months. He can make a tower of 6 cubes at the age of 2 years. And he can make a tower of 10 cubes at the age of 3 years. Some more fine motor milestones that I need to tell you. When does a child copy a rhombus? So a child can copy a rhombus at the age of 7 years. So rhombus is like this. And he can copy a cylinder at the age of 9 years. So he can copy a line at the age of 2 years. He can copy a circle at the age of 3 years. He can copy a cross or a plus at the age of 4 years. He can copy a square or rectangle at the age of 4 years. He can copy a triangle at the age of 5 years. He can copy a hexagon at the age of 6 years. He can copy a rhombus at the age of 7 years. And he can copy a cylinder at the age of 9 years. I am again and again telling you, all of this is something that you just need to remember. I cannot teach you milestones. Milestones is something that I can tell you. You have to remember them for your exams. Whenever you get time, please go through these milestones. That is one of the best ways. I remembered my milestones like this. You have to remember the milestones like this only. Practice. When does a child start using a cup and a spoon for feeding? So for the first time, he starts using a cup and a spoon for feeding himself. It is at 10 to 12 months. But he spills over most of the content. So he's using a cup and a spoon, but he's spilling most of the content. So this is at the age of 10 to 12 months. Uses a cup and a spoon, but with spilling the contents at 10 to 12 months. And he uses a cup without spilling at 15 months and a spoon without spilling at 18 months. So when does he use a cup without spilling? It is at 15 months. When does he use a spoon without spilling? It is at the age of 18 months. So when is he using a cup and a spoon for the first time? It is 10 to 12 months. But that is with spilling the contents. When is he using a cup without spilling? 15 months. When he using a spoon without spilling? 18 months. And last, when does he turn each page of a book singly? So he has a book, he's turning each page of a book individually. Less than 2 years, if he tries to turn pages, he will not be able to turn each page individually. So he might turn 2 to 3 pages together. When is he able to turn each page individually? He is able to turn each page individually or singly at the age of 2 years. So we'll just revise fine motor milestones again. So this finishes up the fine motor milestones. We'll just revise these fine motor milestones again. Okay, so I told you bidextrous approach 4 months, unidextrous approach 6 months. So uses both hands to catch the objects 4 months, uses one hand to catch the object 6 months. Ulnar grasp, so holds the object using the ulnar aspect of the palm 6 to 7 months. Radial grasp uses the base of the thumb to catch the objects 8 to 9 months. Pincer grasp, this is the pincer grasp, thumb and index finger, 9 months, but a mature pincer grasp only at 12 months. Transfers objects from one hand to another hand at 5 to 7 months and plays a ball game, which means catches the objects voluntarily and releases the objects voluntarily. So catches the objects voluntarily and releases the objects voluntarily, both at the age of 12 months. Then tower of 2 cubes at the age of 15 months. So he can make a tower of 2 cubes at the age of 15 months, a tower of 6 cubes at the age of 2 years, and a tower of 10 cubes at the age of 3 years. Then he scribbles. So there is no definitive objects. He scribbles at the age of 15 months. He can copy a line at the age of 2 years. He can copy a circle at the age of 3 years. He can copy a plus or a cross at the age of 4 years. He can copy a square or rectangle at the age of 4 years. He can copy a triangle at the age of 5 years. He can copy a hexagon at the age of 6 years. He can copy a rhombus at the age of 7 years. And he can copy a cylinder at the age of 9 years. All of this is again just revision. Then he uses a cup and a spoon with spilling the content. So he's using a cup and a spoon for the first time. A cup and a spoon with spilling the contents at 10 to 12 months. But he can use a cup without spilling for the first time at 15 months, a spoon without spilling for the first time at 18 months, and he can turn each page of a book singly or individually at the age of 2 years. So we did first category, gross motor milestones. We did the second category, fine motor milestones. Now let us come to the third category, which is language milestones. So this is the third category, language milestones. The first thing that you need to remember is when does a child starts to vocalize. So the child starts to vocalize at the age of 1 month. He's not using any monosyllables or bisyllables, but he's producing some sounds which is known as vocalization. So when does a child starts to vocalize? It is at the age of 1 month. However, when does he start speaking monosyllables? So he starts using monosyllables from the age of 4 to 5 months. Ma, ba, da. So he's now speaking in monosyllables. When does he start speaking in monosyllables? It is at the age of 4 to 5 months. Then by the age of 6 months, he can speak these monosyllables very quickly. This is known as babbling. So what is babbling? Quickly speaking the monosyllables, rapidly speaking the monosyllables. So when does a child starts to babble? This is a PG entrance exam question, not an FMG question, a PG entrance exam question. When does a child starts to babble? A child starts to babble at the age of 6 months. But this is still monosyllables, ma, ba, da. When does he start combining these monosyllables together? Ma, ma, ba, ba, da, da. So now it's combining these monosyllables together. This is known as bisyllables. So when does the child start speaking bisyllables? The child starts speaking bisyllables at the age of 9 months. Then when does the child start speaking 2 to 3 words? By the end of 1 year, most children can speak 2 to 3 words which have a meaning. So by the end of 1 year, how many meaningful words can a child speak? By the end of 1 year, a child can speak about 2 to 3 meaningful words. Then finally, again an FMG question. So this is again an FMG question. When does the child jargons? A child jargons by the age of 15 months. So what is jargon? See, jargon is basically a child is combining some words together. He still cannot form a sentence, but he's combining some words together. How many words? Approximately 4 to 10 words. He can combine 4 to 10 words into a meaningful combination. This is known as a jargon. A child jargons at the age of 15 months. Mind you, this is still not a sentence. This is a jargon. But when does a child start speaking in sentences? The child starts speaking in sentences only at the age of 2 years. So when does the child start speaking in sentences? It is at the age of 2 years. So the first time the child will start combining words. So by 2 years, he can speak almost 100 words with a meaning. And it is at this time that he can combine these words into a sentence. So I'll again repeat. Vocalization, 1 month. So when does he vocalizes? 1 month. When does he start speaking in monosyllables? Ma, ba, da. It is 4 to 5 months. When does he starts to babble? Now he's speaking these monosyllables quickly. It is 6 months. When does he start speaking in bisyllables? It is 9 months. Ma, ma, ba, ba, da, da. So he's combining monosyllables together. How many meaningful words can a 1-year-old child speak? This is a PG entrance exam question. He can speak about 2 to 3 words at the age of 1 year. When does a child start to jargon? A child starts to jargon at the age of 15 months, when he can speak around 4 to 10 words which have a meaning. And when does a child starts to form sentences? The child starts to form sentences by 2 years, when he can speak almost 100 words with a meaning. So first category, gross motor milestones completed. Second category, fine motor milestones completed. Third category, language milestones completed. Now I come to the last category, which is social milestones. So let us now do social milestones. After doing social milestones, we'll have the end of this chapter. So then we can take a break. So social milestones. The first thing that you need to know in a social milestone is a social smile. So when does a child show a social smile? When does a child smiles because he wants to smile? It is at 6 to 8 weeks. A child shows a social smile at 6 to 8 weeks. Another FMG question, when does a child recognizes the mother? So this is again an FMG question. When does the child recognizes the mother? So the child recognizes the mother at the age of 3 months. 12 weeks. So when does the child recognizes his mother for the first time? A child recognizes his mother at the age of 3 months. In fact, this is a very, very important question. This has been asked 2 times in PG entrance exams also, and this has been asked in FMG also. When do children recognize their mother for the first time? It is 3 months. When does the child starts mouthing? So what is mouthing? At 5 months, see, at 5 months, anything that comes in the hand of the child tends to take it to his mouth. It's a very dangerous period because this is the time the child is at a risk of poisonings. He may aspirate the things. So when does the child starts mouthing? Anything that comes in the hand, the child takes it to his mouth. So mouthing at the age of 5 months. When does the child stands and smiles at his mirror image? The child stands in front of a mirror and smiles at his mirror image at the age of 6 months. So he's standing in front of a mirror and he's smiling at his mirror image at the age of 6 months. Another very important FMG question, this again is very important for your exams. When does the child show a stranger anxiety? A child shows a stranger anxiety at the age of 7 months. So when do children show stranger anxiety? Children show stranger anxiety at the age of 7 months. So social smile, 6 to 8 weeks. Recognizes the mother, 12 weeks or 3 months. Mouthing, anything that comes in the hand, the child tends to take it to his mouth, 5 months. Smiles at his mirror image, 6 months. Stranger anxiety, 7 months. Then when does the child waves bye-bye? The child waves bye-bye at the age of 9 months. So when does the child waves bye-bye? The child waves bye-bye at the age of 9 months. When does the child starts casting? What is casting? Please see this. Casting is throwing things away. So anything that comes in the hand, the child will throw it. What was happening in mouthing? Anything that comes in the hand, the child was taking to his mouth. What is casting? Anything that comes in the hand, the child is throwing it. This is known as casting. He's throwing things away. This appears at the age of 1 year. So by around 5 to 6 months, it's very important shift of the milestones. By 5 to 6 months, things that come in the hand, the child will take to the mouth. But by the end of the first year, things that come in the hand, they will throw it away. So mouthing at 5 months, but casting at the age of 1 year. When does a child plays a peekaboo game? What is a peekaboo game? So what is a peekaboo game? What is a peekaboo game? You cover your face and suddenly you show your face to a child who is sitting opposite you and the child feels very happy. This is peekaboo. So when does a child play a peekaboo game? The child plays or enjoys a peekaboo game at the age of 10 to 12 months. This is again a PG entrance exam question. So, milestones, many of them are asked in the exam. So you have to memorize them again and again. When does a child enjoy a peekaboo game? A child enjoys a peekaboo game at the age of 10 to 12 months. When does a child dresses and undresses himself independently? A child dresses and undresses himself independently at the age of 3 years. So before the age of 3 years, it's the parents who are dressing and undressing the child. When does a child dresses and undresses himself independently? A child dresses and undresses himself independently at the age of 3 years. When does a child identify his gender? This again is FMG question. When does a child identify his gender? I am a male, I am a female. When does a child identify his name? And when does a child identify colors? All of them at the age of 3 years. So gender identification, name identification, and color identification, 3 years. Dresses and dresses himself, again 3 years. Another very important question, when does a child becomes predominantly right-handed, left-handed? This is very important. In Ghai, last edition, I think they had written right-handed, left-handed by the age of 3 years. That means when is the child predominantly using either his right hand or his left hand to catch the objects. So in the previous editions, it was written 3 years. In many books, it still continues to be written as 3 years, but I would say the best answer here should be 4 years. So when does a child becomes predominantly right-handed or left-handed? Right-handedness or left-handedness appears at the age of 4 years. I think presently in Ghai it is written, I think 4 years. You should remember, the child becomes predominantly right-handed or left-handed. We all are either right-handed or we are left-handed. This is achieved at the age of 4 years. When does a child achieve a complete bladder control? A child achieves a complete bladder control at the age of 5 years. So any form of bedwetting is abnormal after the age of 5 years. So that is why they say, if you are asked this question, enuresis is a diagnosis. This is bedwetting. So enuresis, a diagnosis should be made only if the child continues bedwetting after the age of 5 years, because a complete bladder control is achieved only at 5 years. Therefore, enuresis should never be diagnosed before the age of 5 years. This is very important. Enuresis is bedwetting. So any child who continues to bedwet after the age of 5 years, then you should investigate the cause, not before 5 years, because a complete bladder control is achieved at 5 years only. And similarly, a complete bladder control is achieved at the age of 4 years. Therefore, passing stools at inappropriate places, which is also known as encopresses. So what is encopresses? Passing stools at inappropriate places. The diagnosis of encopresses should never be made before the age of 4 years. Understand? What is enuresis? Passing urine on bed. This is a diagnosis which is established only after 5 years, because a complete bladder control is achieved at 5 years. What is encopresses? Passing stools at inappropriate places. So you should never make a diagnosis of encopresses before the age of 4 years, because a complete bladder control is achieved only at the age of 4 years. So if someone asks you in the exam, a diagnosis of enuresis should never be made before the age of 5 years. A diagnosis of encopresses should never be made before the age of 4 years. So let us quickly revise this last group. Social smile 6 to 8 weeks, recognizes the mother 3 months, mouthing at 5 months, so bringing things to the mouth, Smiles and plays with his mirror image 6 months. Stranger anxiety 7 months. Waves bye-bye at 9 months. Casting is throwing things away. Casting at the age of 1 year, plays a peekaboo game at the age of 10 to 12 months. So you cover your face and suddenly show your face to the child. This is known as a peekaboo game. So peekaboo at the age of 10 to 12 months. Dresses and undresses himself at the age of 3 years. Gender identification, name identification, color identification, all at the age of 3 years. When does the child becomes right-handed, left-handed? 4 years. A complete bladder control is achieved only at 5 years. Therefore, never make a diagnosis of enuresis before the age of 5 years. And a complete bowel control is achieved at the age of 4 years. Therefore, never make a diagnosis of encopresis before the age of 4 years. So with this, we finish up the fourth group of milestones also, which is social milestones. So gross motor, fine motor, language, and social. Quickly, what was the gross motor milestone we discussed? Now, don't write anything. What were the gross motor milestones? Head control. First sign of head control, 6 weeks. Partial head control, wobbling, 3 months. And a complete head control, 5 months. Then sitting with support, 5 months. But sitting in a tripod position, 6 months. Sitting without support, 8 months. Crawls, abdomen is touching the surface. Crawls, 8 months. Creeps, 10 months. Abdomen is above the surface. But creeps on stairs, 15 months. Stands with support, 9 months. Stands without support, 12 months. Walks with support, 10 to 11 months. Walks one hand held, 12 months. Walks without support, 13 to 15 months. Climb stairs, 2 years. But maturely goes upstairs and downstairs, like I told you, like we do, 4 years. Hops, 4 years. Hopping, 4 years. Skipping, 5 years. This was gross motor. Keep them aside. Now fine motor. Use of grasp. Bidextrous approach, 4 months. Unidextrous approach, 6 months. Ulnar grasp, 6 to 7 months. Radial grasp, base of the thumb. Radial grasp, 8 to 9 months. Pincer grasp, 9 months. But a mature pincer scribbles, 15 months. Line, 2 years. Circle, 3 years. Cross or a plus, 4 years. Square, rectangle, 4 years. Triangle, 5 years. Hexagon, 6 years. Rhombus, like a kite, 7 years. And a cylinder, 9 years. Uses a cup and a spoon for the first time, 10 to 12 months. But this is with spilling the content. So most of the contents are spilled. Cup without spilling, 15 months. Spoon without spilling, 18 months. Turns each page of a book individually, 2 years. Fine motor milestones, keep aside. Language milestones. When does a child starts vocalizing? Vocalizing at the age of 1 month. Monosyllables, ma, ba, da, 4 to 5 months. Babbling, quickly speaking these monosyllables, 6 months. So babbles, 6 months. Bisyllables, mama, baba, dada, 9 months. How many meaningful words a 1-year-old child can speak? 2 to 3 words. Jargons, 15 months. When he can speak 4 to 10 words and sentences, 2 years. Last, social milestones. Social smile, 6 to 8 weeks. Recognizes the mother, 3 months. Then mouthing, bringing things to the mouth, 5 months. Transfers objects, 5 to 7 months. I'm sorry, this I forgot. In a fine mode. Transfers objects, 5 to 7 months. Plays a ball game, 12 months. I forgot this in fine mode. Coming back to social milestones. Stands and plays with his mirror image, 6 months. Then stranger anxiety, 7 months. Then waves bye-bye, 9 months. Then name identification, gender identification, color identification, all at the age of 3 years. Dresses and undresses himself, 3 years. Plays a peekaboo game, 10 to 12 months. When does a child become right-handed, left-handed? 4 years. Complete bladder control, 5 years. Complete bowel control, 4 years. Therefore, never make a diagnosis of enuresis before the age of 5 years. Never make a diagnosis of encopresis before the age of 4 years. So these are some pictures. I would now expect you to remember the milestones, and based upon the milestones, just see what ages these pictures correspond to. So let us quickly see and revise the milestones. Picture number 1, you can see a child who is on his hands and knees and his abdomen is above the surface, so he's creeping.